Go.
Hi, my name is D.Hughes. I'm going to be assessing the neck and head vessels, or the neck and heart vessels, I'm sorry, and the peripheral vascular and the lymphatic vascular system today. I'm going to start with the carotid artery. The carotid artery is palpable, normal, at a +2. I'm going to auscultate. No thrills are present, or no bruits are present. Okay. And I'm going to have him lay down, and we're going to look at the jugular venous pulse, and I'm going to estimate the jugular venous pressure. I'm going to have him turn his head slightly over to the side, and I'm going to note where the jugular pulse is located, and I'm going to put this ruler on the sternal notch, and then this other ruler in a T shape at exactly where the end of the ruler is exactly where the pulse is seen, and that is at 2 centimeters. Then I'm going to look at the aortic impulse, and it is located approximately at the 4th or the 5th intercostal space. And I'm going to have him take a deep breath in and hold it. Okay, and I am able to feel that. That is okay, thank you. And the size of this is approximately 1 centimeter, and the pulsation is normal. And I'm going to palpate across the chest to indicate if there are see if there are any thrills or lifts, and there are not any. Then I am going to percuss on the outer edges of the heart. Okay. I'm going to auscultate, and as I auscultate the heart, I am going to tell you what area I am auscultating. This is the aorta. This is your pulmonary artery. This is your left ventricle. This is your right ventricle. This is your right aorta, your right atrium, and then back up to your aorta. Your heart rhythm is sinus rhythm. I do detect the S1 and the S2, which is the systolic and diastolic, and I do not hear any additional heart sounds, nor do I hear murmurs. I'm going to ask him to move slightly on his left side so I can hear this with my bell, just to make sure that there are no murmurs or additional heart sounds present. The heart rate is at 84 beats per minute, and it is normal and regular. Go ahead and sit up. We're going to look at the lymphatic and the peripheral vascular system. I'm going to start with the arms. The arms are symmetric in length, and they are symmetric in diameter. The skin is warm, dry, and moist. The brachial pulses are palpable and at a +2. The radial pulses are also palpable bilaterally at a +2. And your epitrochlear nodes are palpable, free movable, non-tender, and they are not enlarged. I'm going to go ahead and have him lay down, and I'm going to check the inguinal nodes. The inguinal nodes bilaterally are palpable, freely movable, non-tender, and they are not enlarged. The legs are symmetrical in length and in diameter all the way up. The skin is, the skin turgor is normal. There is no presence of edema or lesions. The skin is warm, pink, moist, and dry. The femoral arteries are palpable bilaterally. Your popliteal arteries are also palpable bilaterally. Your anterior tibial pulses are palpable bilaterally. All of these so far are at a +2. And your dorsal pediis are also palpable at a +2. And this ends my assessment. Thank you and have a good night.